And apart from the WBCs, what do the RBCs and like the hemoglobin values usually tell us, like from the blood test?
They tell us quite a bit in terms of the patient's overall well-being. So one thing is that on the red cells, we have different parameters that are used. So one common thing is your, red MCV or mean corpuscular volume. So if the mean corpuscular volume is low, that usually suggests there is iron deficiency. And this is very common in Indian patients. A lot of times, the clinicians may not realize there's iron deficiency until they do not just smear, but also a differential and, a complete blood count to get the red cell indices. And so, if you have low MCV, the other option, other thing is, hemoglobinopathies like thalassemia. It is relatively common in certain ethnicities in India, especially from Kutch and Kutchi Lohanos. So those patients need to be tested if they have chronic anemia, even if the CBC is normal. They need to be tested with hemoglobin electrophoresis to identify if these patients might have thalassemia. And then similarly with the leukocytes, one has to look at the differential. Just doing the CBC will not give us an idea, but when the patient gets a differential count, one can see what different types of leukocytes are in the circulation. And depending on the subtypes, the most common are neutrophils and lymphocytes. But in cases where you have imbalance, where the lymphocytes might be higher, that might suggest abnormalities, both benign as well as malignant. So that's why it's
Mhm.
important to look at both.
Mhm. Thank you so much, doctor.